It's time once again for a sponsored segment on First at Fort we call Medical Monday. On most Mondays, I talk to one of our sponsors from the medical community about the services that they provide. My guest today on Medical Monday is Dr. Michael McCracken from McCracken Family Chiropractic, and he's brought a patient's mother along with him, Miss Laura Miller. And what's our little patient's name?
This is Morgan.
Morgan's with us too. All right, we're going to come right back to you guys. But first off, you've been talking about it for a while, but now we get to see it, your book.
It's here. It's here. It's the best self-help guide to really getting yourself healthy through nutrition, physical therapy, exercise. There's pictures, there's how-tos in there. It's just a great book. You can call my office to get your copy today.
More than chiropractics.
Oh, yeah, everything.
All right, super. Well, let's go ahead, and speaking of chiropractics, we have a very young lady with us today, and she's one of your patients. Talk to us about that.
She is. Both of these are actually, almost the whole family's a patient. Father's watching. What happened is people don't understand that chiropractic care, if it's good enough for you, why is it not good enough for your child? And the reason we don't think of it is because we think that there's a lot of adults who are reluctant to let a chiropractor adjust any bone, much less the neck. That's where we get scared. And so when it comes to little patients like Morgan, this is the last person we're going to refer to. But what happens is when we're born, the most traumatic incident that you're going to go through in life is actually birth. Even if you're C-section, because they actually twist, grab, torque, and pull, and we can't show it, but if you'll Google a C-section image of birth, you'll know that there's a lot of twisting and turning and pulling that goes on in a child's body when they're being born. And that can actually compress the nerves in the neck that go to the sinus cavities, that go to your eyes, your nose, your mouth, your ears. So we see kids with ear infections. They even go to the heart and the lungs, the nerves that exit the brainstem, such as the vagal nerve. And so that can affect heart rate and respiratory problems. And believe it or not, when we check kids, almost all of them have had some kind of issue from birth. And Morgan was one of those cases. And I'm going to let them explain more of their personal story so she can give you an idea of what happened with Morgan.
Absolutely. Laura, let's go ahead. What is the story with you and with Morgan? What's been your experience with Dr. McCracken?
Well, it's been great. Morgan is 19 months old now. She, from the very first month, she started having ear infections and just one antibiotic after another. And she had tubes at 6 months. When she was about a year old, she started developing allergies and asthma troubles. She was on 2 inhalers, one inhaler, and then a rescue inhaler if she had an asthma attack. So she was on 2 inhalers twice a day and some allergy medicine as well. And about a month ago, I was in Dr. Michael's office and asking him, how could her spine be out of line? And he explained, and so we checked her, and she had a little scoliosis and a shift. After her first adjustment, she slept all night, which was something that she had not done in weeks. She was waking up with breathing troubles. After the first week of adjustments, he adjusted her 3 times a week. We reduced her medicine, took her off the morning dose. After 2 weeks, she was off all of her medicine, and we haven't had any troubles since. It's been amazing. It has been.
That sounds amazing, and obviously, you had some great needs with Morgan. What about other kids? Would you recommend this for everybody, or what's your take?
Yes, actually, she has a 3-year-old brother who is feeling left out, getting his adjustments. He talks to my mom about getting adjusted from the chiropractor, and he's been asking lots of questions, so he's going to get checked tomorrow. And I've suggested it to lots of my friends with children, and just something so simple. She loves getting popcorn from Dr. Michael. That's what she calls it. So.
All right, well, guys, we're out of time, but Dr. McCracken, always good to see you, and nice meeting you too.
Thank you.
And I believe she's found something else that she likes other than popcorn.
She does. Tell them bye. Say bye-bye. Wave, Morgan.
There you go. Yeah. That's how you exit a segment. All right, if our sponsor sparked your interest today, you can give them a call down at McCracken Family Chiropractic. The number is 205-345-5035. You can find out more about them online at McCrackenFamilyChiropractic.com.